those of you that have been in the industry a while, you might be saying, duh, I know I need to be credentialed. But for those of you just starting out, this may be a brand new concept to you. Credentialing is the process of obtaining, verifying, and assessing the qualifications of a provider, or in our case, an optometrist, to provide care or services for a practice. It is the very beginning of your revenue cycle. Credentialing is important because once you are successfully credentialed with an insurance company, that means that you are in network and you can bill them and get paid. It can be quite a process, but it is worth it for some insurances, especially those that are very common in your area. Before you select which insurances that your doctors in your practice are going to be in network with, do some homework. Figure out who the largest employers in your area are and which insurance company they use and provide to their employees. In addition, you should check to see what their reimbursements, allowables, or allowances are to make sure that you're not going to lose any revenue later. One sure plan to be in network with is Medicare. Medicare currently has 64 million members and is expected to rise to 79 million by the year 2030. Since Medicare patients are typically 65 years and older, it is safe to say that they will probably need glasses to be able to see. So, it doesn't hurt to keep these patients coming into your practice for their yearly eye exams. To learn more about credentialing with Medicare, visit www.cms.gov/Medicare and look for the credentialing section. Medicaid can be a beneficial plan to be in network with as well, depending on how busy your office is. Like I said, do your homework and figure out which plans are most utilized in your area, and that way you'll be able to better identify which plans fit your patient population and which ones to start credentialing with. Once you have selected which plans you want to be in network with, now it's time to figure out what their process is. Unfortunately, there are different credentialing processes for different insurance companies and for different states. So there's no standardized set of rules or steps that apply to a credentialing process. However, most plans do require you to credential each individual provider rather than just the practice as a whole. I always check the insurance's website first to see what I can gather. Sometimes there will be a simple form that you can fill out and submit immediately, or a form you can print out and mail to them. Usually, these are just generic forms that you submit, and then somebody should contact you or at least send you a credentialing packet to start the process. If you can't find anything online, you'll have to call. Now, if you've dealt with insurance in the past, you know that calling insurance can be quite a hassle, to say the least. So, the best advice I can give you is to figure out who your network representative is and contact them directly. Another great way to streamline the credentialing process is to create a CAQH profile for the provider. CAQH is an online credentialing database that's free to use. The provider you work for may want to set up a CAQH profile themselves since it asks for a lot of personal information. However, most offices have somebody that does this for the providers. While CAQH is great, not all insurances use their platform for their credentialing process, so there are still some that you will have to do manually. To learn more about CAQH, visit proview.caqh.org. Credentialing can be a lengthy process, so it's good to get started as soon as possible. Some plans will be super easy to deal with and take maybe 30 days. Some plans will be semi-easy to deal with and take 60 days. And some plans are awful and they take 3 to 6 months. To try and make the process a little more seamless, get as much information and documentation as you can in the beginning. Like I said before, there's no standardized set of steps or rules for credentialing, but here's a list of information that you will probably need. A Type 1 NPI, a Type 2 NPI, the provider's optometry license, a photo ID or a driver's license, the provider's malpractice insurance policy, a DEA and state drug license, if applicable, the provider's CAQH number, the provider's date of birth, and their social security number. To make it a bit more simple when you start out credentialing, we have included this form for you as a practice enhancer. Now, once you send in your credentialing packet and everything that they are asking from you, you wait. To stay organized, start a reference sheet so you can keep track of everything. This would be a list or a spreadsheet of all the doctors that you are credentialing and every single insurance plan you'll be credentialing with. This list should include the insurance name, the contact information, reference numbers, and then dated and detailed notes about what you have sent to them, what you are waiting on, what they have said to you, etc. Because once you send the initial forms into the insurance, you will have a million other things going on, and you won't remember where you're at or what you're waiting on, right? To help you stay organized, we have added this spreadsheet as a practice enhancer so you can keep track of your credentialing. organized and keeping an in-depth list within arm's reach is essential to getting through credentialing in a timely manner. Once you're done with the credentialing process, the insurance company should send you some kind of welcome letter letting you know that they're done with their process. However, this is not always the case, so keep that reference sheet and make sure that you're following up with all the insurances you haven't heard from. Another thing to keep an eye out for is that insurance company's fee schedule. Remember in the last section when we talked about allowables? Well, a fee schedule is a list of allowables for each billable charge for each insurance company. We will discuss fee schedules and why they're important in the next section, setting proper fees for your office.